So, what if I told you there's a medical diagnosis that's so broad, it's almost like a mechanic telling you that you have car trouble? Today we're diving into something called neurogenic bladder. It's a single term that actually covers a huge range of different conditions. We're going to break down how doctors cut through all that confusion to figure out what's really going on. So how can one single diagnosis, neurogenic bladder, possibly describe dozens of different problems? That is the puzzle we're going to solve today. It's a classic case where a simple name is hiding a really complex and sometimes pretty dangerous reality.
To get to the bottom of this, we first need to understand why this diagnosis is so confusing in the first place, not just for patients, but for doctors too.
Okay, so here's the official definition. Neurogenic bladder is really just a catch-all term. All it means is that the bladder isn't working right because of some kind of nerve problem. But that nerve problem could be anything. It could be from a spinal cord injury, a birth defect like myelomeningocele, where the spine doesn't form properly, or even a degenerative disease. The cause totally shapes the problem, but the diagnosis itself, well, it doesn't tell you how.
Think about it this way. You take your car to the mechanic, they look under the hood, and they just say, "Yep, you've got car trouble." Not very helpful, right? Is it the engine, the brakes, the transmission? Neurogenic bladder is pretty much the medical version of that. It tells you which system is failing, but not the specific part, or more importantly, why.
So, if the diagnosis itself is way too broad, how do doctors get the specifics they need? Well, that brings us to the hero of our story, a really powerful diagnostic tool that lets them decode the bladder.
You know, the key question for any doctor in this situation is this. How can you actually see what's happening inside that bladder from moment to moment? How does it fill up? How well does it store urine? What are the pressures like inside when a person coughs or moves?
And the answer is something called a urodynamic study, or UDS for short. You can basically think of it as a stress test for the bladder. By filling it up and measuring every response in real time, doctors get this incredibly precise, dynamic picture of exactly how it's working or not working.
And this is what they get. Now, I know it probably looks like a crazy jumble of squiggly lines, but for a doctor, every single one of those lines tells a crucial part of the story. They can see the pressure inside the bladder, the volume, the muscle activity, all at once. This isn't just a static picture. It's like a movie of the bladder in action.
To make this all really concrete, let's look at 3 patient stories from our source material. Now, they all have the same underlying condition, but their UDS results are going to show us 3 vastly different problems.
First up, let's meet TR. He's 24 years old, and he has a history of myelomeningocele, that spinal cord birth defect we mentioned. He came into the clinic because he was having more and more leakage, especially at night. On the surface, it seems pretty straightforward, right? An incontinence problem. But his UDS told a much more dangerous story. Look at that graph. Those really sharp peaks show that he has a small bladder with dangerously high pressures. And the X-ray on the left shows what that does. It creates this classic Christmas tree shape. That is a huge red flag for a hostile bladder, where that intense pressure is putting his kidneys at serious risk. His problem isn't just leakage, it's a direct threat to his long-term health. Okay, now let's meet ME. He's 44, and he also has myelomeningocele. And, just like TR, his main complaint is incontinence. So same diagnosis, same symptom. You'd think he has the same internal problem, right? Well, his UDS revealed the complete opposite. His bladder had a huge capacity and was very compliant, which just means it could stretch and hold a lot of urine without the pressure spiking. Most importantly, the pressure was low. You can even see how smooth his bladder looks on the X-ray. For ME, the bladder is a perfectly safe storage tank. His kidneys are not at risk. His treatment can focus purely on managing the leakage, a completely different goal than for TR.
And our third case is JG. He's 20, also with myelomeningocele, but his issue wasn't leakage, it was something more subtle that popped up on routine lab work. His creatinine levels were slowly climbing. Now, creatinine is a waste product filtered by the kidneys, so when that number goes up, it's a clear warning sign of kidney stress. His UDS uncovered a third, entirely different problem, detrusor sphincter dysynergia, or DSD. Now, this sounds complicated, but think of it this way. The bladder muscle that's supposed to push urine out was squeezing at the exact same time as the sphincter muscle that's supposed to relax and open up. It's like flooring the gas and slamming on the brakes at the same time. The muscles were literally fighting each other, creating a functional blockage and high pressures that were backing up and hurting his kidneys. So these stories show just how vital UDS is for diagnosis, but its role doesn't stop there. It's also absolutely critical for managing patients through one of the most dangerous periods of their lives, that transition from pediatric to adult care. Our source material is really clear about this. It notes that kidney deterioration is common during the teenage years. And while the reasons are complex, a major factor is something we can probably all relate to: teenage rebellion, which can lead to not sticking with treatment plans as closely.
This timeline really shows the journey. In infancy and childhood, there's very close monitoring as the bladder's behavior sort of declares itself. But adolescence, that's a minefield. It's a high-risk period where rapid growth and changing habits can completely destabilize a bladder that used to be safe. This is why regular follow-up during these years is, as the source states, absolutely mandatory.
And here are the specific risk factors doctors are looking out for. Things like rapid growth spurts can actually change the way the bladder functions. And as we just talked about, poor compliance with a catheterization schedule or with medication can have really serious consequences. This isn't just about managing symptoms, it's about preventing irreversible kidney damage.
So, what does all of this add up to? Well, it points to the absolute need for a personalized approach to care that lasts a patient's entire lifetime.
This table just brings it all together so perfectly. Here is the solution to our puzzle. You've got 3 people, all with the neurogenic bladder diagnosis, but each one has a unique UDS finding that demands a completely different treatment plan. TR needs aggressive treatment to lower his bladder pressure. ME just needs help managing leakage, and JG needs treatment to fix that muscle discoordination.
And that is the crucial point. The term neurogenic bladder is just a beginning of the story. It's the urodynamic study that provides the all-important details, allowing doctors to move way beyond a catch-all diagnosis to a truly personalized treatment plan that can protect the patient's kidneys and their quality of life for decades.
And that really leaves us with a bigger question. The story of neurogenic bladder isn't just about bladders. It highlights a critical gap in our healthcare system, that transition from pediatric to adult care. So for any chronic condition that begins in childhood, how do we build a better bridge of care that supports patients not just for a few years, but for their entire lifetime?